I'm Alon Mordell. I am an emergency medicine physician here in New York in Manhattan, and I am the medical director at K.
And I'm Ido Paz. I practice internal medicine and cardiology, and I'm the VP of Medical at K Health here in New York City.
And today we're going to talk to you about diabetes. The definition of diabetes is having too much sugar in your blood. And there's two big categories. It's either type 1 or type 2.
So on a very basic level, insulin is a hormone that helps regulate the amount of sugar in your blood. In type 1 diabetes, the problem is a lack of production of insulin. In type 2 diabetes, the problem is that your body's cells are not sensitive enough to insulin, often because of an excess of fat. It's important to know which one you have because the treatment for each is different.
Either way, your body just can't use the sugar in the blood, or it can't use it efficiently, and everything backs up and you have way too much sugar just floating around in your bloodstream. And the end result of this is that the way your body takes care of it is you end up peeing a lot of it out, and then you get really thirsty, so you're drinking a lot of water. And in the background, because you're not using your sugar well, you're getting tired and you're not feeling right. And so the constellation of feeling off and tired, drinking too much and peeing too much are the earliest signs that you're developing diabetes.
Oftentimes, diabetes is going to be noted on routine screening. You might do annual blood tests with your doctor to look for glucose in your blood, using such tests as a finger stick glucose or a hemoglobin A1C. And if you have persistently elevated blood sugar, that's when you meet criteria for diabetes.
Diabetes is a very treatable condition. Controlling your blood sugar is something that medicine does very well. But it's important to do so because the consequences of uncontrolled blood sugar over your life are pretty grave. That's when you hear about people losing their feet and their vision because their blood sugar was out of control. It doesn't have to get to that point. If you control your blood sugar now and you diagnose things early, then you can avoid the complications that might happen down the line.
So if you're diagnosed with diabetes, you're definitely going to want to work very closely with your doctor to come up with a good treatment plan. For every diabetic patient, lifestyle changes like changes to your diet, changes to your exercise habits, and weight loss are going to be extremely important. There's also a lot of different medications that exist for the treatment of diabetes. Not everyone is on insulin. Most people are on either pills or injections that can help your body regulate the amount of the blood sugar.
And if you don't know whether you have it or not, and you're feeling unusually tired, you can download the K app, you can put in your symptoms, and you can see if you meet criteria or not, how other people like you were managed and diagnosed, and you can always press a button and talk to a doctor.